Hello everyone. In today's video, we are going to learn about a topic named ethical issues and ethical dilemmas in nursing. So what is this ethical dilemma in nursing? Coming to the definition, ethical dilemma is a situation wherein the nurse has to compete between her values, or she has to make a decision between two values. In simple, it interferes with their code of ethics, or it interferes with their personal and professional ethics and also values. Thereby it makes the nurses work more complicated and creates a burnout situation for nurses. In simple, it is a situation wherein the nurse cannot decide what to do, whether to do it in one manner or it in another manner. So this is called as ethical dilemma, and there are also different types of ethical issues faced by nurses nowadays, and these issues should be addressed and proper solutions should also be provided to these issues so that the nurse may not enter into these types of ethical dilemmas. When does this nurses face this type of ethical dilemmas? First of all, the nurse faces an ethical dilemma when the patient refuses to take treatment. It is mandatory for the nurses to provide treatment, but when patient is not cooperative with nurse or refuses to receive that treatment, nurses fall into an ethical dilemma whether to provide the treatment or to stop the treatment while respecting the patient's rights as well as patient's choices. And second one is whenever patient or their family members deals with death or life situations wherein they want their loved ones to live or to let die, all these situations create some dilemma in nurses whether to do or not. And the third reason is when the nursing group or the nursing peers have less incompetence in doing the work or in providing high quality nursing care to the patients. So in that area also nurses fall into ethical dilemmas whether to accept that situation or to avoid that nurse to provide care. And the last reason why nurses faces ethical dilemmas is due to inadequate staffing pattern. So the nurses ratio usually in hospital setting is like from 1:2 to 1:1. But when there is an inadequate staff, the workload on one staff or the other staff will be high. That leads to less productive work in the wards as well as in other healthcare settings. That also leads to various ethical dilemmas in providing perfect and equitable care to all the patients in the hospital. There are some areas where nurses has to fight with this ethical dilemmas, in that the first one is addressing to the patient's rights or respecting the patient's rights. In some conditions, respecting the rights of the patients may not help the patients. For example, if the patient is refusing the treatment, the nurse cannot silently respect the patient's rights and say, I respect your choice, so I don't want to give treatment. But at that point of time, she is in an ethical dilemma whether to provide the treatment or not. And the second dilemma usually the nurses faces are the breach of confidentiality, whether to share the information to any other healthcare professionals or anybody inside the healthcare unit, because maintaining confidentiality and privacy of the patient is very important and it is a part of code of ethics for nurse. So in life and death situations, maybe sometimes the nurses need to share the confidential matter of the patients to the respective healthcare professionals. So at that point of time also the nurses may enter into ethical dilemma. Another area where the nurses seem to face these type of dilemmas is informed consent. If the nurses forget to take the informed consent from the patients before administering a medication or getting into operation theatre or going for a surgery without a consent, maybe the nurse has to face the legal issues. If there is any issues concerned with the patient's health, if she does not take a consent, maybe later she has to face some legal issues. So in that area also the nurses has to be very careful in taking the informed consent from the patient before starting a procedure or before doing a procedure or a surgery on a patient. And another area where the nurses seem or find difficult to deal with the situation is end of life decision making. It means if the client is in a end stage due to any chronic illness or any cancerous condition, maybe the patient's relatives or the patient himself or herself says that I want to end up my life. So there the nurse falls into an ethical dilemma what to do. Of course, she has to take the help of a higher authority, and there should be a doctor or a surgeon to assist or to take a proper decision. So this is the area also the nurses feel very difficult in taking care of the end life situations of the client. How nurses can identify or take these situations into consideration? First of all, the nurses must think that they are not alone and they have a good support system in the healthcare areas. So there are different healthcare professionals to come together to deal with this ethical dilemmas. Ethical dilemmas or ethical issues which is falling in front of a nurse should never be ignored. All nurses should take ethical dilemmas into consideration with the help of other healthcare professionals. So each situation she faces, she should take the help of other healthcare professionals, and working together can help the nurse to come out of the dilemma very easily, thereby not hurting the patient or not ignoring the patient's feelings or choices, as well as keeping up our values and code of ethics in our profession. And what are the consequences of nurses who ignore this type of ethical dilemmas? So there are many consequences the nurse has to face when she ignores this type of ethical dilemmas. As I've already stated that ethical dilemmas should be addressed, it should not be ignored. So taking into consideration with the help of other healthcare professionals can help the nurse to move out of that situation very easily. Similarly, if the nurse ignores this ethical dilemma, first of all, she has to face many legal problems in the future. If the ethical dilemma is not corrected immediately with the help of others, later she has to face many other legal problems, and she has to address the patient as well as their relatives and many more people wherein she has come across during that phase or that situation. Second consequence the nurse face if she ignores the ethical dilemma is nurses easily get burnout. Usually ethical dilemmas creates lot of stress in nurses. So if it is not addressed immediately, that stress is carried out through many days and the nurses faces burnout and they'll have less job satisfaction. And even there are certain situations wherein the nurses loses their job if these ethical dilemmas are not addressed or informed to the respective authorities. And also there is a permanent loss of their licensure, means the license they receive from the Council of Nurses to work wherever they want anywhere in the world, that can be cancelled, or the licensure can be lost if the nurses won't address ethical dilemmas at proper time to proper people through proper channel. So these are the various consequences the nurses face while dealing with ethical dilemmas.